How does optic neuritis affect your color vision? Imagine looking at a colorful world, and suddenly some of those colors seem dull or washed out. That's often what happens with optic neuritis, a condition where the nerve connecting to your brain becomes inflamed and damaged. This inflammation disrupts the way visual information, including color signals, is sent from your eye to your brain. One of the most common signs of this disruption is a change in how you perceive colors, especially early on. People often notice that colors appear less vivid or more faded, a condition called dyschromatopsia. This isn't just a minor annoyance, it's a sensitive sign that your optic nerve isn't functioning properly. The impact on color vision can vary from person to person. In the early stages after an attack, many people find that blue and yellow colors are hardest to distinguish. Over time, as the condition progresses or begins to recover, red and green colors may become more affected. Interestingly, the pattern of color loss doesn't follow a strict rule and can change during recovery. Some individuals might experience different types of color vision problems at different times, making each case unique. This variability means that the color vision impairment in optic neuritis doesn't always look like what you might see in other optic nerve conditions, where certain color deficits are more predictable. The severity of color vision loss often correlates with how much the central part of your vision is affected. But this isn't always the case. Some people may have significant trouble with colors even if their sharpness or clarity of vision seems okay. During the acute phase, when symptoms are at their worst, color perception can be notably reduced, even if your overall vision isn't severely impaired. As the condition improves, some color vision may return, but in many cases, a small amount of deficit can remain long-term if the nerve damage is significant. Doctors can objectively measure these changes using special tests that assess how well you see different colors, especially red, green, and blue. These tests often show that affected eyes score lower in color perception compared to unaffected eyes. Imaging techniques like optical coherence tomography can also reveal structural damage to the nerve fibers and the retina, which helps explain why color vision is affected. The longer the time since the initial episode, the more likely it is that these deficits may worsen or persist. In summary, optic neuritis often causes a noticeable reduction in color vision, affecting multiple colors and changing over time. This change is a reflection of nerve inflammation and damage, and it usually occurs alongside other symptoms like vision loss, eye pain, and visual field defects. Monitoring how your color vision changes can give doctors important clues about how severe the nerve damage is and how it's progressing. If you experience any changes in color perception, it's essential to consult an eye care professional for a thorough evaluation. Remember, each case is different, and personalized medical advice is always the best way to understand and manage eye health issues related to optic neuritis.